there's two rules in the office. One, the diagnosis is not the disease. And number two, it's always about everything. You're trying to put out a fire without finding the arsonist. And if you don't find the arsonist, you're just going to have another fire start somewhere else. You got to look at, and the whole concept of deeper healing is about finding the arsonist and eliminating, arresting the arsonist and then putting out the fire.
Welcome to the Deeper Healing Podcast. I'm your host, Danielle Howley. This is for everyone who's been dismissed, misdiagnosed, or told to just live with it and refuse to accept that answer. You're going to hear amazing patient recovery stories, raw and real in their own words. People who found answers after everything had failed them. You're going to hear from medical experts we trust that are pioneering new approaches to healing the body because we deeply know we're designed to heal. Let's dig in.
I am so excited today. I have the co-founders of Deeper Healing Medical Center here in Charleston, South Carolina, Dr. Michael Bauerschmidt and Danielle Howley. They are here and we are going to talk about mold illness. If you are out there and suffering from brain fog and chronic headaches, chronic fatigue, we are going to get to the bottom of your root symptoms and talk about how mold might be the missing link to your symptoms. So, so excited to have you guys here. Dr. Bauerschmidt, he's an environmental medicine doctor. And let's just jump right into it. How did you get into environmental medicine?
Oh my God, that's quite a story.
Well, give us the short version.
Well, the short version is after a car accident took me out of the ER, I tried the traditional route of medicine and saw the neurologist and the physiatrist and the trigger points and the epidurals and all the long and short acting narcotics and muscle relaxants and physical therapy, and eventually had a percutaneous disc decompression because surgery always works when medicine fails, and ended up with an infection in my disc in my spine and then 6 weeks of IV antibiotics. And I was still a dyed-in-the-wool, card-carrying member of the Church of the Medical Orthodoxy, but I ran into a fellow I used to work with in the ER, Dr. Mark Rosenberg, and he said, "Mike, let me give you some IV vitamin C." And I looked him dead in the eye and I said, "Mark, I thought you were a doctor." And he said, "I am. What have you got to lose?" Well, the short version is I had a few infusions of vitamin C, and for the first time in almost 3 years, I realized what it was like not to be in pain. And that led me to explore the whole idea of functional medicine. I went and did a few courses. I did some continuing education and opened up my own clinic in Fort Lauderdale, Florida, Full Potential Healthcare. And there I was taking care of hormones and gut health. But there's 20% of the people I just could not figure out what was wrong with them and why I couldn't get them better. And up popped this advertisement for a thing called environmental medicine. And they said, if your patients have blah, 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 I went, those are my patients. They said
What's
they
the
could,
blah,
they,
blah,
could-
blah?
they could be environmentally injured and you need to learn about how the environment impacts your health. And I went, yes, I do. And I took the course with Dr. Walter Crinion. Since that time, I've been just fixated on what's it going to take to show that if we get rid of the toxins, that we can make people healthier. And I went to, I took a job at another location where I became sick with mold myself. And at the time, there was only basically two approaches to it. One was from a Dr. Jim Brewer out of Kansas City, who had a lot of chronic fatigue patients. He was an infectious disease doctor. He was standard dyed-in-the-wool, allopathic medical doctor. And he did a study on about 100 of his patients, and he did a mycotoxin test on all of them. And sure enough, virtually all of them had these mycotoxins called mycotoxins present. And he treated them with a combination of a nasal spray, a combination of something to break up biofilm, and then something to kill the fungus. And over 90% of them got better. Yeah. Not cured, but better. And I kind of went, there's something going on here I need to know about even more. And even though I knew about the chemicals and metals and indoor air pollution and food and things like that, the mold was kind of a missing piece. The only other person that was out there talking about mold at the time was a Dr. Richie Shoemaker. I found his program was just a little too precise. You had to have A in order to go to B and had to complete B before you went to C. And I went, that just doesn't make sense to me. I mean, this is you've got to take a more all-encompassing approach. And I kind of developed my own program for myself.
This is one thing that I got to jump in. I love about you. You just said it twice. You were like, I got really curious about something that wasn't working. So you're always searching, which you're still do to this day. I love that so much about you. And also it has to make sense. The whether it's a treatment or a test or anything, it has to make sense. But then you're like, but then I'm going to test it, and I'm going to test it maybe on myself, and then I'm going to run the labs. And
I'm always on myself first.
Yeah. I do love that about you.
So, what was your story? How did you get exposed to mold?
I have to be careful how I answer that, because there was a non-disclosure agreement made at the time of the termination of the employment.
Wow. I didn't realize that.
The facility that I worked at did not want to recognize that mold was a problem, even though it was a healthcare facility. The founder of that facility did not believe that mold could cause illness.
Which is a very common thing, like in schools and where people work. We see that a lot with patients. They're like,
everybody's got mold.
Yeah.
There's mold in the food supply. Now, yeah, there is. Unfortunately, that mold is not necessarily the stuff that's going to kill you.
So you were exposed somewhere where you were working.
Yes.
And what were you? Did you get really sick?
I was very sick. I ended up with 5 major abdominal surgeries because I could not heal. Each surgery led to another complication. And within a 12-month period, I had what's called 5 laparotomies, where they kind of had to cut me open and move things around and put things back together again.
So the big picture is you had the mold exposure and it was suppressing your immune system. So
the immune system is what heals you.
Yeah.
If your immune system isn't working, you're not going to heal very well. And since then, I found that mold illness kind of comes in 2 flavors. And I see this often within a family. They say, well, I've got a family of 5 people. How come not everybody's sick the same way? It's because everybody's, there's always a straw that breaks a camel's back. But it depends on how much straw that camel is already carrying. And some people, and some camels are bigger than others. They can carry more straw. And within any given family, 20% of those camels aren't going to carry very much straw, and they're going to get very sick very quickly. The rest of the camels may notice a little, what I call the sneezy wheezies. And this is the reaction you have to the mold spores and the hyphae. And it's more of a classic like allergy season kind of symptoms, or they may just feel a little run down. The people with the mycotoxin illness, which is another animal entirely, these are the folks that get perilously and seriously ill. I mean, you can end up with central nervous system symptoms. And a lot of this shows up as just like brain fog and fatigue and, gee, where did I just can't put my finger on it kind of thing. Sleeplessness, anxiety. People walk in with anxiety and brain fog. One of the first things I think about is mold. But then from there, it can progress on to the autonomic nervous system. So the folks that are walking around, I have this irritable bowel syndrome. I've been treated for SIBO 5 times and I just can't get better. And then there's the folks with the immune dysregulation that just aren't healing, or the Epstein-Barr flares. I was on a podcast once with some folks, and one of the sponsors, or one of the hosts, was part of the original group that was studied for Epstein-Barr virus as the link to chronic fatigue syndrome, or myalgic encephalomyelitis, as it's called now. At any rate, off radio, he was saying, the common denominator and all. First of all these folks are in Reno, Nevada. And says, well, it's in the mountains. There shouldn't be any mold there.
Right.
Well,
that's what they would think.
That's what you'd think. But no, there's if you build a house after 1970, you're likely going to have mold, and we can get to that in a minute. But the bottom line was, yes, all of them had Epstein-Barr, but all of them also had Stachybotrys growing in their home.
Oh, wow.
The classic black mold. And that's it. And so, for me, people don't have chronic Epstein-Barr. They don't have chronic Lyme. What they have is a failure of the immune system. Because,
that's a mic drop right there. That's, yes.
The Epstein-Barr, the herpes, the shingles, all these viruses are in you forever. Once you got them, you got them. They're with you. And it's your immune system's job to keep a lid on them and keep them intact. And if that lid comes off, then you get a flare. And that flare is usually the response or the inability of the immune system to respond, oftentimes secondary to things like molds or metals or any of the other environmental toxins. If I can.
I don't want to forget something that you just said when you started this riff, which was so important because everybody says this. There's a family of 5. They're always convinced it's not mold because they're not all sick.
Yeah.
They always say that. That is such a huge myth.
Yeah, it is.
And they inevitably end up going down bad trails because they're like, it's definitely not that.
Mm-hmm.
And then when you're sometimes the first person who's like, no, just because, mom's sick and daughter's sick and the other 3 are not, that doesn't rule it out.
Exactly.
Because that's what is like constantly said in the office.
Yeah. And let's just take for a moment. And there's a good example of that is people will come in and I'll run a mycotoxin test on them and they'll say, well, let's confirm that I have mold illness. I said, no, just tell me whether you have mycotoxins or not. And, everybody's going to dump stuff, well, let me back up.
You might need to explain that.
Let me back up just a little bit more
know what that
because the body doesn't really detoxify. It biotransforms. So it takes something that you can't get rid of and turns it into something you can get rid of. And it's a 3-step process. So the first thing you have to do is change it from something that's fat soluble that will stay in your body into something that's water soluble that you can put into the bloodstream and get rid of in your urine or your sweat or your bile. The second step is getting it out of the cell. And then the third step is getting it out of the body. Well, the first step is handled by this thing called the cytochrome P450 system, which makes that initial transformation between lipophilic to hydrophilic. Then the second pathway, I'm sure people have heard about methylation pathways. Well, that's not the only way out of the cell. There's glucuronidation, there's sulfation, there's glycation, there's several other pathways that any of them become disabled or less than optimally functioning can cause a buildup of these now water-soluble toxins into the cell. So let's say you can get them out of the cell, and now they're in the bloodstream. Now you got to get them out of the body. So there's 3 major pathways, 4 if you count breath, but I've only found breath to be good for things like onion and garlic. But everything else usually has to come out in either the stool, the urine, or the sweat. And so what happens though is how this ties into that thing about whether you're peeing out toxins or not. The people of that family of 5, people will come in. The person that's sickest may have the least amount of toxins in because they can't get rid of them. And the person that's least sick, usually the dad, for some reason, I don't know why dads, probably because they're out working or something, they're not in the house as much as the rest of the family.
It is, I think.
Yeah.
You see that a lot.
Yeah, I do. And it's like dad's peeing out toxins like crazy, feeling good. The rest of the family's suffering and they're hanging on to him. They don't have nearly the level that he does.
Yeah, so they're really bad excretors or bad. I know you don't like the word detoxification, but a lot of people know the term detox and detoxification pathways, but basically they just are very poor detoxifiers.
Yeah, exactly.
So their pathways aren't working well. So all of these mold toxins kind of get clogged up in their system, and now it's causing inflammation, it's causing immune dysfunction, it's kind of throwing the body off. So let's talk about maybe a patient that came to see you. Like, give us a good case study. I love a good case study of someone that came and like what you discovered and how you got them better. Like, what was your most severe patient case?
Oh, that had to be a young girl from Philadelphia who she had been to CHOPS, Children's Hospital of Philadelphia. She'd been to the Mayo Clinic. She'd gone to no less than 20, 25 docs, was it, Danielle? You remember her.
I remember her.
She came in with gastroparesis. The stomach just quit moving.
Wow.
And she had a G-tube and a G-tube so that it could decompress the stomach when it got over full, but they also had to eventually put in a feeding tube into her small intestine so that she could get any kind of nutrition at all. And she was and it was an old house in the Philadelphia area. And it was
she was sleeping in the basement.
And she was sleeping in the basement.
Oh, really?
Yeah.
How old was she?
She was 13, 14 at the time.
She's young. She's a teenager.
There was a flood.
Yeah.
and they cleaned it up,
Mhm.
cleaned it up.
Well, they cleaned it up, but didn't dry it out
Right.
and remediate.
Right. And,
Yeah.
I mean, I'm from Pennsylvania. A lot of those basements, they are very mildewy, moldy smelling.
Mhm.
Um, and so she slept down there for years,
Mhm.
and her health was going down and down and down, and they were never connecting it to the basement.
Nobody does.
But she was getting very sick, so they're like, we have to go to the best children's hospital in the country. We're going to go right down to, they were out in, maybe 50 minutes in the suburbs. They went down to Philadelphia, and they did their full functional health deep dive kid program,
Mhm.
basically.
They came up with
They
nothing.
came up with
Yeah.
nothing.
So what were her symptoms? Like you said, the gastroparesis problem, but that's probably like after it's been a while.
Oh, yeah,
Like
that
what
was-
were her, was it just like the
Well,
brain?
it's just kind of progressive learning disability, fatigue. It was just, and a couple of his sisters had the sneezy wheezies,
Okay.
and Dad thought they were all nuts
Mm-hmm.
because he was fine.
Yeah.
But unfortunately, we were never able to get the feeding tube. I mean, she eventually got over the feeding tube, but the gastroparesis I never could reverse that. I mean, sometime once you get the structural changes taking place, it's very hard to reverse disease.
So is it common with mold illness and mold exposure for the gastroparesis? Like I don't remember
that's not a huge one, but that
Okay.
I mean, you want to talk about the most
She was-
dramatic case.
yeah.
I mean,
then that's how severe it
that is
got.
how severe it can get.
But it's funny.
There's another,
Were you thinking of?
Catherine.
Oh gosh.
Yeah, a beautiful young woman. Had a house, has a house down in the Battery area. Husband's successful businessman, but just horrible mold. Is chemically sensitive, which means she couldn't stand being around odors or smells of perfumes or cleaners or anything else without becoming physically ill, nausea, vomiting, headache, sort of thing. Got her cleaned up with her mold, and she went on to have 2 more children by twins. Actually, cleaning up her whole system.
I love that. She calls them her deeper healing babies.
Yeah.
And her full story is going to be in the movie that comes out this summer, 2025, where there's going to be a documentary, Hope for Deeper Healing. And her story will be in there, and it's really, really powerful. The one thing I want to add something to this mycotoxin conversation, which is the symptoms are so wide ranging. So, if you ever look up, mycotoxin illness, and there's like 37 different things, but even to see it manifest when you'll see someone come in, Ava comes to mind with the facial rash, and you're like, no one would ever think that was mold.
Yeah.
Gastroparesis. Gray came in a wheelchair.
Yeah.
She came in with this rash on her face, and you would they're so wide ranging that you would almost not even connect the dots. And if you were going down a traditional road, you would go to a dermatologist, you would go to the specialist for that area.
There was another woman from Ohio that came, and she had eczema herpeticum. So it was eczema caused by the herpes virus, and it was all on her face. And it looked like somebody had taken sandpaper and just scrubbed on her face.
It was so painful.
Nobody could. It's like antivirals, and it's like, oh, you got a virus, treat the virus. And it said, no, you're chasing the wrong bug here, guys. It's not the bug, it's the immune system. Find out why the immune system wasn't working. Well, she was living in a moldy house. We got her out of the moldy house. We treated her mold. We got rid of the mycotoxins. We cleaned up the colonization that was likely taking place in the sinuses, and put her on a low-dose androgen therapy. Her face cleared up. She's a happy woman with a boyfriend 10 years younger than her, and
she's amazing. Do you know what's funny? Because she's in a state we're not licensed in. She flew in 2 weeks ago, And she said, I have to come here once a year to stay a patient of Deeper Healing, and you're the only people I trust. So she flew in, had her appointment, flew back home. I'm like, wow. She's like, all I need is LDA. I'm like, but she's like, I'm not going anywhere else for it. I'm coming back here and seeing you guys. But that was a really crazy, that's the thing, like, I think people think mold, they think sinuses, or like, they think.
And that's part of the sneezy wheezy.
Yeah.
And as in the ENT literature back in the 1990s saying, if you have chronic sinusitis, you've got a fungus in there. Well, guess what? Mold's a fungus.
I don't even see them saying that anymore.
No,
I know.
And they still put people on an antibiotic and a steroid. The antibiotic's not going to kill the fungus, and the steroid's going to suppress the immune system even further. And they wonder why they don't get better. Why do they have chronic sinusitis? Because you're treating the wrong thing.
So I have a quick question, and I don't think I mentioned this in the beginning, but Dr. Bauerschmidt, he was an ER doctor for 30 years?
22 years.
22 years. Okay.
I'm not that old.
Sorry. So were you trained in, not as an ER doc, but when you went to medical school, did they talk about mold or teach you that? Like in your immunology classes?
No. The standard thing is toxins can't hurt you because your body can detoxify.
Yeah.
Which once upon a time was true. The medical education changed dramatically in the 1920s when they standardized it. And that was the result of a thing called the Flexion Report. Now, we'll go down that rabbit hole right now. But what I wanted to say is around that time, the only two major toxins we had to deal with were heavy metals, which has been around since the Bronze Age, when man first started pounding metals together. And the other was mold, which is mentioned in Leviticus.
Yeah.
About what to do if you have a moldy home. And basically, you treat it with lamb's blood or burn it down, But then we had a couple of millennia of reasonably healthy environment to live in until, 1948, when A.I. DuPont came up with this thing called C8, which in 1954 was marketed as Teflon. And ever since then, it's been a race of better living through chemistry, to the point that for every living man, woman, and child in the country of the United States, we could give between 250 to 500 pounds of chemicals on a daily basis.
Yeah, it's crazy.
That's how much we're making and how much we're using. Now, on top of that, we've also added this thing called, if people remember the OPEC oil crisis back in the 70s, speed limits dropped down to 55 miles an hour. But the big change was not the speed limits, it was the building codes change. And now we had to build our homes airtight because we had to save on fuel costs for heating. Well, when you build a nice airtight house, you don't get airflow. Well, you don't get airflow, you start building up indoor air pollution from the off-gassing from the paints and the carpets and the fabrics and the furniture and the non-stain coatings on the furniture and the perfumes and the fragrances and the scented candles to make the inside smell better because you're trying to cover up the mold smell.
Yeah.
And so indoor air pollution actually is worse than outdoor air pollution. And now we add the final layer, and this is going to be a straw that breaks a lot of camels' backs, is the electromagnetic frequency pollution, which has been demonstrated to show that, at least in a laboratory, you put an EMF source next to a mold and that mold goes berserk.
Yeah.
It just starts pouring out the mycotoxins because it feels threatened. Mycotoxins, you have to remember, are the mold self-defense mechanism. If that mold feels threatened, you start to dry it out. If you have put another mold in there to try to encroach on its territory, you try to clean it up, it's going to flare and cause even the release of more mycotoxins, which is going to make you even sicker, which is why you have to be really, really careful about how you clean up mold. There's a great book by John Banta. He's just releasing it, I believe, this month, April, about mold in the home, and but it's mold free, I believe, is the name of the book. But John Banta is the author, and in it he's been in remediation work for decades, and his thing is you never use bleach on mold. It just kind of irritates it.
That's what everybody does.
It's what everybody does. It's like soap and water. And he says, Branch Basic soap. It's clean, it's easy, and the when you saponify the mold, because mold has both a hydrophilic water-loving layer as well as a fat-loving layer. Well, the soap will emulsify or you kind of dissolve that that fatty layer and allow the mold to break apart and wash away.
Oh, cool.
So just plain old soap and water is what you want to use.
What kind of, did you say branch soap?
Branch Basics.
I don't know Branch Basics.
That's what we use. That's one of
Yeah.
our, that's what we use in the center. And it's
Yeah,
one
I
of
was
our.
so happy when I
it's
saw it in the book. I went, yes.
Where did you get it?
That's a brand. It's a
Okay.
brand. You can order it.
You can get it
Yeah,
anywhere?
It's in our shop. It's in our,
Oh,
if
our
you go to
Amazon store?
deeperhealing.com, Clean Home, it'll be in there.
Oh,
It'll be in there as
Yeah.
a product.
I didn't even see
The
it
other
there.
thing I want to say to you, and I say this like, I laughingly say this to people, but like, how did we come to build paper houses on swamps? I mean, seriously, it's the dumbest thing in
yeah,
the world.
North America is the only place that you're
It's
going to find
crazy.
wood construction as the primary building material.
Yeah.
Most of the rest of the world uses brick,
Yeah.
stone.
Well, I go to Ireland and it's like they have the plaster and like, they're.
And interestingly, South Florida, particularly, far hotter, far moldier potentially, but they don't have as much mold issue in the house because of how they build. Everything's
Mhm.
built on a slab
And they
with
do the-
CBS construction, so cinder block and stucco
Yep.
with a concrete tile roof.
Right.
I mean, it's like
They
a little
build it
fortress.
for
They
that-
build
for
it-
that
they
humid
build it for the
environment.
environment, and we're not doing that anywhere else. And humidity is a problem. Just simple thing like, what's your thermostat set at during the summer? Where do you keep yours at?
Usually around probably 67.
Okay.
I know.
Wrong
Trust
answer.
me, I know exactly what you're going to say.
Yeah, wrong answer, because there's this thing called the dew point.
Yep.
And around here in South Carolina, that dew point can be 70, 72 degrees.
Mm-hmm.
And the dew point is the point at which the water vapor in the atmosphere can no longer be suspended in the air, and it precipitates out as condensation. So if you're waking up in the morning, you got condensation in your windows, or you've got water on your ducts, your temperature is way too cold, and I can guarantee you're going to have some mold issues, because particularly in your HVAC system, it's very easy to grow aspergillus and penicillium. 62-63% humidity is all you need, and that's, if you got condensation, you got mold.
I don't think we have condensation, but I've been telling my husband freezes me in my house.
Yeah.
So now I have a reason to tell him.
Yeah,
We
75
got to turn it up.
degrees.
75?
Yeah.
I'm going to.
We're a bunch of mold phobic people
Yeah.
at Deeper Healing. I have
Yeah.
to say, I mean, we all live,
Oh,
it's
it'd be
funny. We
hot.
say that all the time, like to patients, like, they get like, do I need to move away? I'm like, look, we all live here and we all live in places and we work in places that are non-moldy.
Mhm.
But we are also vigilant. Like,
Well, one of the patients she came to me before you walked into my office, and we started Deeper Healing, and for her daughter, and says, you've got a mold problem, and we can deal with the mold problem. And she went, nope, I'm moving to the mountains. And guess what?
She got better.
no, she didn't.
She
Oh.
crashed and burned because she could not escape the mold.
Oh.
It had already colonized.
It had already,
her
so it was
body.
in her body. And it was already affecting her.
And the
Okay.
mountains
she
do
just
not.
did the
The mountains
escaping.
have their own. Remember, the original thing for Epstein-Barr was done in Reno, Nevada. That is not sea level,
I
folks.
know, I would not think
Oh,
that.
wow. Okay. So, well, the common thing sometimes you see when people they're having mold exposure, they leave and
Mhm.
they'll get out of their place and they just start immediately feeling better within 5 days, a week, 10,
And that
they're.
can happen if they.
But what you're
Mhm.
saying is once you're colonized and it's in you,
Well, it depends on your body's ability.
and if you can't
to,
detoxify
there you
it
go.
or
Because,
biotransform it.
Thank you.
So
The fancy word is
So-
deprivation.
Well, and I think I actually have a client that I've already referred her to come to Deeper Healing. But she lived in a house before, but I don't think people put those two together, which is the reason I want to talk about it. She lived in the house, 3 years ago, and they just recently moved, and now she's been in this house for two years, and her symptoms have been getting worse over the past couple years, and so they check their new house that they're in, but we're maybe not connecting that. No, it was your old
Mhm.
house that made you sick. And
15 years. I've had the folks in their early 30s come in and they say, my house is clean, but I lived in this moldy dorm in college.
Yeah.
And what happens is you get colonized. And it's always about the total body burden.
Yeah.
Okay. The straw that breaks your camel's back may be the mold, but the colony of mold that you've been carrying around with you for 15 years on top of new indoor air pollution from the off-gassing of your new home, or bad diet selections, or not having filtered water, or having a lot of chemicals-based cleaning materials, or whatever the added thing is, that final straw doesn't mean the mold isn't a problem. It's just part of the bigger picture problem. It may not be the thing that tips you over the edge, but it is a part of the thing that pushed you over the edge.
Yeah.
How many kids, I think about this all the time, these dorms at these colleges, I mean, they close them down in May, all the kids are out. They turn them back on at the end of the summer. They give it a lick, of paint. And they let them move in.
But it's not the dorms, it's the schools. It's the grade schools and the high schools as well.
Yeah, I was just going to say.
So
they shut everything down during the summer.
maintained.
Dorms may be used, year round, depending on the school, because they usually have summer semesters or whatever. But high schools and grade schools are far worse.
I mean, 3 years ago, do you remember we had a girl come in from one of the local big universities here? She was the first one, and you were like, this is mold. And she's like, oh, yeah, there's so much mold in my dorm. And then she came back and was like, every kid in my dorm is sick. Every kid. So they started telling the other parents, like, we have a major problem here. They ripped the building down.
Yeah.
It was not remediatable at all.
Right.
That building was torn to the ground and started over.
Yeah, start over. I had a friend, and she started to have MS-like symptoms. And she's a teacher. And, she was really scared. I mean, it was a very scary situation. And I was like, and she said a lot of the other teachers are really, really sick. And because she just kind of reached out to me and just, what do you think I should do? Like all these symptoms. And she was going to all the different neurologists and everything. And I was like, it is mold. That school is loaded with mold. And if you wouldn't find out, it was a couple months later, they had to move all the teachers out and all of them. But they were like working her up. I mean, doing spinal taps, like trying to figure out, like, it's MS, like telling them it's a neurological issue, like something's wrong with them. And it's literally like all these teachers are getting they're all going crazy. Like, because it's.
And you got to look at, you got to look, because I had another patient, worked in a school, had mold with Graves' disease, as thyrotoxicosis, and got rid of the mold. And what people have to start thinking about is that, there's two rules in the office. One, the diagnosis is not the disease. And number two, it's always about everything. And by that, the diagnosis is not the disease. The diagnosis is a handy hat or a hook to hang your hat on that says, now I know what we're talking about the same thing.
Yeah.
But it's not solving the problem of why you have it.
No, it's just a name.
Yeah, it's just a name. And it gives traditional doctors the opportunity to write you a prescription.
And code it and give the insurance money and all the things.
all that downhill stuff. So but the bottom is you're trying to put out a fire without finding the arsonist. And if you don't find the arsonist, you're just going to have another fire start somewhere else. You got to look at and the whole concept of deeper healing is about finding the arsonist and eliminating, arresting the arsonist and then putting out the fire.
Yeah.
So diet is important, because if you've got crummy fuel coming into your system, you're going to have worse exhaust coming out. It's about emotional balance. We see a lot of people that, emotion is, an emotional turmoil, a divorce, a death in the family, an illness. And people come in, you walk through my doors, you've been given the gift of desperation. I mean, you've been ill for so long, you're worried about it, whether you're ever going to get better. And that in and of itself is going to keep you from getting better. The environmental factors, the 5 things that I mentioned, the metals, the mold, the chemicals, the indoor air pollution, and the EMFs are all complicit in our health, and they're all arsonists. And then lastly, physical. What's already wrong with you? Well, you're a 48-year-old female that's having hot flashes and night sweats. Well, you better get your hormones fixed, because your hormones are your cellular messengers. And you're telling your cells what to do, when to do it, and how to do it. And so you get all this stuff fixed. You eliminate what you don't need and rebuild with what you do. And you've got a system that you can carry with you for the rest of your life about, I'm not feeling well. What do I need to do? Well, what's changed in my diet? Am I pulling the fire alarm in my brain? Have I moved into a moldy house? Am I, dealing with too many chemicals? Am I going through menopause? Are my hormones balanced? Let's eliminate the bad stuff and rebuild with the good stuff. Deeper
And if that
healing.
sounds really overwhelming, because that can sound really overwhelming, this is what deeper healing does every day. It literally helps you figure out not only what it is, how to reverse it, but in what order to reverse it.
Yeah.
I mean, that's something else you touched on earlier. I was like, oh, we have to follow that back up again, because they might come in with their SIBO or their, fibromyalgia or whatever.
But
And
why did they have it?
that's the thing.
Otherwise, you're
ever-
just chasing your pharmaceutical tail.
Exactly. Exactly. And then we've seen it time and time again. When you actually get to the reason why you're sick, reverse that reason, the body does the work.
Yeah.
It heals itself. It's already perfectly designed. It's like so amazing.
Just got to give it the correct circumstances in which to heal.
Yeah. Like, we're so happy when our patients fly away, we never see them again, even though we totally miss them. But it's like they're living their lives, and it's so beautiful. It's so beautiful.
And that's my goal in life was to never need me. Unfortunately, the way the world's going, I'm afraid they're always going to. I'm not worried about job security.
Oh my gosh, they're so sick out there.
Well, and that leads me to let everybody know who's listening. So, we are here in Charleston, South Carolina, and Dr. B, Danielle, they're the founders. I've recently joined the team.
Hey.
And as a naturopathic doctor, we were trained under Dr. Krinian, who was a renowned environmental medicine doctor. And Dr. B is a renowned environmental medicine doctor as well, being trained under him. And, we've found this need to just be able to help more people. I know Danielle does a lot of the calls of the patients coming in, and there's so many people out there to help, and we can only do so much. We are training more practitioners and trying to grow, and but we now have some online courses that are coming out.
You got to bring up the course.
Yeah, so we've been working really hard. 3 months it took us, which actually is pretty good for an online. That's not too bad. So I literally followed Dr. B around, and we went through everything he does in the office for patients, and we went over just different case studies and everything from how do you find mold in your house, all about testing humidity. How can you do it on your own? What's the Amazon equipment you can purchase? And, what are things that you can do at home? And then what I'm really excited about, module 4 of the course really breaks down good, better, best. So everybody's on different budgets, and it's like, okay, well, if I'm on a really tight budget, what can I do that's kind of the least expensive thing? And then if I want to spend a little bit more money and do some other things, because the whole goal is we got to get this mold out of you. We have to upregulate these certain pathways. And Dr. B has certain protocols. The course is called the Mold Recovery Protocol, Deeper Healing Mold Recovery Protocol. So we really break it down for anybody and everybody on any budget, because coming here to Deeper Healing is one investment. You can come do our Stay and Heal program, or just, do a consult with a doctor. But if you're from far away, it's like, well, what can I do now? Because if you have mold exposure and you're really sick, like, you have to start now. Like, you can't wait.
How many people have called our office from a very far away state, family, frantic? So first of all, most people don't know that they have mold.
Are you usually the first one to say, I think you have mold?
No, the people that call us, because we are very well known as a mycotoxin expert, those people know they have it. They've already gotten to that point. Many people that come in with other medical symptoms often learn in their consult that they suspect there's a mold problem. Not everybody.
Like autoimmune and stuff like that.
Autoimmune or wide-ranging symptoms like we talked about. But those families that are like, I can think of this one family, they were just so sick, and they're in Ohio, and they were, we found the mold, we're working on it, we have no money, we're trying to you're trying to figure out, how are you going to live in the middle of your whole family being sick? And I'm so excited to be able to say, go right here, get this course, watch it in your hotel room, whatever. It's going to walk you through it step by step. This
Yes.
course that you guys put together is going to change lives.
It really will.
For those people that have the understanding, this is our problem. We need to fix this. This is going to be the best course you can get out in the marketplace, and it's going to make it guide you step by step on what to do next.
Yeah, it's literally everything we do in the office for our patients. I mean,
And
Dr. B
beyond, and
gives
beyond.
like everything for the nasal sprays and what to take orally and like and how to do it. And I think that's where talking about the order is so important, because you want to make sure like you do everything in the right order, because if you try to start detoxing yourself too fast, you're going to make yourself sicker. And if you're not binding the toxins and removing them. So Dr. B goes over all of that in the course. And we have a whole full script store where you can go get everything, and it's like really put together well. We have people auditing right now. We're going to be launching it here in a couple of weeks, but I think it came out really good. Dr. B is a really good teacher. He really breaks things down, and you just really like learn the whole picture, because it's not just about, there's not a medicine that's really going to fix your mold problem.
No.
Like you have to really do a couple different things, and we just break it down, and you did a really great job. And it's only like 3 hours too. It's not a very long course at all. I think 2.5 to 3 hours. We included a bunch of bonus items and downloads and stuff, so it kind of depends.
Well, and I love how you organized it by module, so you can go to like, I need this,
Oh yeah, you can jump like right ahead. We
give
give you full access when you get into it. It's not like one you have to like watch the first one and then open it up. But we're going to be training physicians too. So if anybody out there's listening, if there's physicians out there, I'm the part of the clinician or education team here, and we're just helping take all of Dr. B's protocols and, get them out there to help more people. So that's our whole mission. And
I'm so excited about that, because there are so many more doctors that need to know about this.
Yeah.
And I think there's even interest in it, but then where do you go? So this is going to be huge.
Oh, one more thing I'll add. We give away the testing and everything. So we tell you how to test for mold in your house, which is a specific dust test. And then we also talk about the mycotoxin testing that Dr. B recommends as well. You can order the kit and have it sent to your house and get it. If you ordered it today, it'll be there in like 3 days. So it's very easy to take control of your health. Like that's what's so awesome, is I think we're giving everybody the tools to like just go all in and learn what they need to know,
So
and
it's-
not guess anymore.
No.
Like,
And
I
you no
think
longer have to
no.
worry, do I have mold?
Yes.
No, you'll know.
Yeah.
There's
You'll
mold
have
a
all the
problem
answers
for me.
Yes.
right
Yeah.
there.
Just like find out, and then you know what to do.
Mhm.
So
Well-
you would say it's really soup to nuts. It's everything.
It is. I mean, I am 100. Yes. If you get in there, like you get access to everything. And I think like one thing too, because if you're listening to this or you saw the name of the episode, it's like, oh, what's Deeper Healing doing? And knowing Dr. Bauerschmidt and mycotoxins. And, if you're here, you probably may suspect mold is an issue, or, or you might want to learn more. But I feel like, and I just want you to speak to this too, because you talk to so many people that, with my experience talking to them who have mold toxicity, they have so much brain fog and they're so confused and they can't think.
I tell you, back to my original symptoms.
Yeah.
One of the first things was the chronic fatigue. I thought, I'd sold a practice in Fort Lauderdale. I moved halfway across the country, started a new job,
Yeah.
was instantly tired. I thought, oh, my adrenals are burned out. Maybe that's the problem. But then the brain fog set in.
Yeah.
And the brain fog was so bad, I would be sitting across from a patient. I'd ask them a question, and I couldn't remember what it was I just asked them. And then I'd have to kind of surreptitiously glance at the computer to see who it was I was talking to, because I had no idea who they were.
Oh my gosh.
That is so not you.
And it's scary too.
It's
But I
scary.
know,
It's
I guess I just
incredible.
wanted to speak to those people. Like, I mean, I get it with, like, a lot of times I think people hear all this information. It's like, they don't even know what to do, because by the time patients get to us, they are like so desperate. They're like, I don't even know what to, like, they're just in this brain fog and the depression, the anxiety, all the mental stuff that goes along with it. So we get you. And that's who we wrote this course for and tried to break it down and make it really easy. We even put together an outline so you can like follow along and take notes, and like it's just like so well done. I don't know. It's really awesome. And I know the people out there that are listening, if they have mold exposure, we know it's tough to think like, how am I even going to focus on a course? it's so short and simple, and we get straight to the point and just break it down. And it's
And you can go
just get
back.
it.
You can go back and
And you
rewatch
can go
it
back.
as many times as you like.
Exactly.
You sure can.
Exactly. Because
You sure
I
can.
cannot even begin to tell you the amount of agony and suffering of the families that are dealing with this, their fear about where they're going to live, how they're going to afford to fix their place, getting their family better and back on track. I mean, it's the most unbelievable derailment of your life. And until you've been through it, or you know someone who's been through it, you cannot even truly understand. And I know there's going to be people out there that are going to be like, oh God, like I've been through this, or is this happening to me? This is a really easy way to find out. This is a really easy way to find out. And everything is in there for you. So
Yeah.
great job, you guys.
This was awesome. Thank you so much for coming on today. And if anybody else is out there and needs more information, you will see all the information somewhere around this video. You can also get more information at deeperhealing.com. And
we'll put the course link down there as well.
Yeah, we'll have the course link around here. Or a lot of people are listening. Some people are watching it on video. So just look around.
Okay.
And we will see you next time. Thanks, guys.
Thanks, guys.
Thanks.
We hope this episode inspired you. Here's how to go deeper. Visit deeperhealing.com to become a patient. Online, we have loads of courses and a free toxin quiz. Subscribe and please, please share this episode with someone who needs it. It's always that one-on-one support that really gets people to find deeper healing. Remember, this is educational content, not medical advice. The information shared here should be discussed with your own personal healthcare provider. If you're excited by listening to the medical experts or the personal recovery stories on here and you want to start your own deeper healing journey, go to deeperhealing.com and start your process.